Guys, how are you? Today we are going to discuss about drugs for constipation, and diarrhea also in some other videos. But now we are mostly concerned about drugs for constipation. So these drugs are also known as laxatives, purgatives, or cathartics. Okay, mostly we will call these as laxatives, and these laxatives are classified into bulk forming agents, stool softeners, stimulant purgatives, and osmotic purgatives. These bulk forming agents are dietary fiber, bran, xylem, plantago, isapagula, and methyl cellulose. Stool softeners are docusage, dioctyl sodium sulfosalicylates, and liquid paraffin. And the stimulant purgatives are again classified into four. They are of diphenyl methanes, which is bisacodyl, sodium picosulfate, anthraquinones, ammodanes, senna, cascara, sagrada. And 5-HT4 agonists are prucalopride. Prostaglandin analogs are lubiprostol. So osmotic purgatives are magnesium sulfate, magnesium hydroxide, sodium sulfate, sodium phosphate, sodium potassium tartarate, lactulose, lactitol. So let's quickly discuss these drugs. Before discussing these drugs, we should have basic idea about what is laxative, what is purgative, and what are the mechanism of action. So laxative, it is also known as aperient. So it helps in elimination of soft stools. So but these stools should be already formed. But purgatives, they will cause more fluid retention and forceful evacuation of the stools which are unformed also. Okay, many drugs in low doses they will act as purgatives, whereas in high doses many drugs in low doses they act as laxatives, as in high doses they act as purgatives. So mechanism of action is hydrophilic or osmotic action. They retain the osmotic means what electrolytes they will retain. So hydrophilic, they like more water, so they retain more water. Acting on intestinal mucosa, they decreases the absorption, they increase the propulsive activity and decrease the non-propulsive activity. So these laxatives, they modify the fluid dynamics of the mucosa, so mucosal cells, and they will cause more fluid accumulation in the gut. So first, by what mechanisms this is occurring means by inhibiting the sodium potassium ATPase of the villus cells. So this sodium potassium ATPase is inhibited means, so then sodium and water retention will occurs in the intestinal lumen, because sodium takes water along with it, but now we are inhibiting the pump, so water and sodium will get remains in the lumen. So stimulation of adenyl cyclase, this adenyl cyclase will convert ATP into cyclic AMP. The cyclic AMP is secretory, so it secretes electrolytes and water, so in the crypt cells. So then enhances the prostaglandin synthesis in the mucosa, which enhances the secretion. Okay, secretion of electrolytes and water again. So increase the nitric oxide synthesis. This increases the secretions and decrease the non-propulsive movements, which help in removal of the feces. So and structural injury to absorbing intestinal cells. So if absorbing intestinal cells are damaged, then this water and electrolytes are not absorbed into the intestinal mucosa, and they will return in the lumen, and they help in easy passage of the stools. So coming to the first class of the laxatives, they are bulk purgatives. They are bulk purgatives. In these we are going to discuss about bran, xylem, isapagula, and methyl cellulose. So for coming to the bran, it is a first line approach for the simple stools, simple constipation, and 40% of dietary fiber constitutes this bran, which is a wheat husk. Okay, so it absorbs water in the intestine and swelling of the intestine, and it causes increase in the content of the feces. Okay, water content in the feces. So osmotically active products will be formed after the bacterial degradation in the colon. So these dietary fibers examples are gums, lignins, pectins, and bile salts. So finally they will cause a degradation of cholesterol also in the liver, so it lowers the LDL cholesterol levels to some extent, so it will be useful in obese people also. Okay, What are the drawbacks? Means this taste is not some good, so unpalatable taste, and large quantities if you take 20 to 40 grams per day, then only we can observe some action. Okay, so full effect needs requires daily intake for 3 to 4 days, does not soften the stools which are already present in the colon, not useful for already constipated subjects. So contraindications are ulcerations, adhesions, stenosis means narrowing cases, so irritable bowel syndrome. And if we give in irritable bowel syndrome, then the symptoms of the irritable bowel syndrome will be aggravated. In irritable bowel syndrome, means first few days patient will complain of diarrhea, and after some days patient will complain of constipation. So with inflammation and irritation in the colon. Okay. So coming to xylem, we will also name it as plantago and isapagula. So isapagula also we will discuss here only because mostly same. Okay, so it contains natural colloidal mucilage, so bulky gelatinous mass by absorbing the water, largely ferment in the colon. So refined isapagula husk 3 to 8 grams we should take with cold milk or fruit juice. Okay, once daily or twice daily. So action will be in 1 to 3 days. So some may think it is not acting like that. Okay, it's followed if you swallow dry, it will cause the esophageal impactions. So we should not take it dry, you should take it with cold milk or fruit juice. So prolonged intake of isapagol and the soluble fibers, they will cause the rectosigmoidal intraluminal pressure reduction. So it helps in relieving of the irritable bowel syndrome. Symptoms of chronic diverticulosis may also be relieved. Okay. Coming to methyl cellulose, it is a semi-synthetic colloidal hydrophilic. What we'll observe, see, semi-synthetic. It is not completely artificial nor not completely natural. It is semi-synthetic. And colloid it is hydrophilic. So it retains the water in the lumen. So of cellulose, and largely it is unfermented in the colon by the bacterial action. It is unfermentable, and a dose of 4 to 6 grams per day, it is satisfactory in most individuals. It improves the stool consistency in patients with colostomy. Colostomy means some opening will be we will open the colon. Okay, so water means we will make small opening in the colon. Okay, ostoma means some opening. So water should be taken along with the all bulk forming agents. So that's all for today. We'll discuss stool softness in another lecture. Okay, thank you guys for listening to me patiently. Thank you.